We'll discuss like ours today, first class. Yeah, first class about the pathology and about what is pathology, introduction to pathology. You are third year students, so we're going to discuss about this. How important is it? Yeah, why do you need the pathology? What are the tasks of pathology? What are the aims of pathology? What are the methods of pathology? What to do with pathology at all? Like, okay? What is the pathology at all? We have to start from the definition. The pathology comes from the two Greek words, pathos and logos. Pathos means suffering of the disorder, and logos means starting. So if we'll provide the shorter definition, that's the starting about the diseases, starting about the pathological states. And let me provide you an example. Like we have the normal state of the organism. Then something like predisposition factors we have causative factors like etiology. We have the mechanisms of the development of the pathological states, and finally the normal state converts into the disease. And there is a long way. Sometimes it's longer, sometimes shorter. But anyway, it takes time, always. And the pathology as a subject studies this one. It studies the conversion and why the normal state is converted into the disease. Really answering three main questions there are. So what happens in case of pathology? What are the changes of the tissue, organs, cells, so on? Second question is where it happens really. Is it happen within the cell, or maybe outside the cell, connective tissue, or maybe within the wall of the blood vessels? What organs are affected exactly? And the third question, and really the third question is most important thing, is why it happens. Once more time, to interrelate, to connect the morphology of the disease, its possible complications and outcomes with etiopathogenesis, with the causes and the mechanisms. To talk about the rules of the development of the pathological conditions. Like when you play in the game, any game, like chess. Before you sit to play the chess, you need to know the rules of the chess. Same being the doctors. Before to treat and to diagnose the people, you have to know about the rules of pathology. The rules of the development of the pathological states. That's the main aim of the pathology as a subject for the medical university. So the particular information about the particular diseases, you will know from the therapy or surgery or obstetrics or some other disciplines. But knowing the pathology and studying the pathology is a kind of knowing the rules of the game. Before start to play the game, you have to read the rules. You have to understand the rules. Yeah? And just before, you started about the normal conditions. You know about the normal functioning of the human body. But you didn't know about the diseases and what will happen in the cells, tissues, or organs of the human body in case of the injuries. In case of the injuries, damage, about different kind of pathogens. And that's all about the pathology. Okay? So, the pathology studies the changes during these processes, transition from the normal state to the formation of the diseases, on the different level of the structural organization. And those levels are, and the biggest one is the organism level. As a macroorganism, as a human body totally taken together. Then all the organism consists of the systems. So the next level is the systems of organs or systemic organ classes. Systems consist of organs. Organs consist of tissues. Tissues consist of cells. And then we may continue. Cells consist of ultracellular structures as the organelles, so the nucleus, cytoplasm, mitochondria, Golgi complex, endoplasmatic reticulum, so on, so on, so on. So ultra structures of cells or subcellular level, as well as we may also go deeper to the molecular level as well, to the DNA molecules, to the RNA molecules, to the proteins, to the processes of the transcription, so on, so on, so on. So, what is, am I clear now about this? Okay. What is the basic level for the pathology? I mean, basic level of the starting of the disease. And this basic level is the level of the cells. Starting from the Virchow, which is the father of the cellular theory, all the pathology starts from cells. And we may go upward on this scale for organization level, or we may go downward to reveal those changes on the cellular level and to confirm them on the ultrastructural level or even on the molecular and biochemical level. So that's quite important. And continue talking about those levels, we need to understand, so how can we see the differences on the different levels? What methods can we use to reveal those changes? Especially we are talking about the morphological changes now. If we are talking about starting from the level of the organs and upwards, everything here is about the macroscopical changes. Those changes we can see by our eyes, we can touch, we can use spatial imaging studies like ultrasound, computer tomography, X-ray examination, so on, so on. For the level of the tissues and the cells, we have to use another one, level of microscopical changes using the light microscope, using the spatial methods of the histological examination, and starting from the ultrastructural level here and even below for the molecular level as well. We may use electron microscope method. We can use again some other spatial methods using same microscopical even techniques, using the immunohistochemistry methods, using the fluorescent in situ hybridization method to show the mutations in the genes, so on. That about the main thing, main methods of investigation and the structural levels of organization. Just short recap about what did I say just now. The pathology, that's the basic thing for the medical education. That is the studying about the pathology, studying about the pathological states and the disease. Everything what was happened in between the transition, during the transition from the normal state to the disorders. And taken all together, the pathology as a science include starting off etiology of the disease or causes, pathogenesis of the mechanisms, morphogenesis and the morphological changes of the diseases, their complications and possible outcomes. like a rule for the medicine, a rule for the pathologies. We can study those changes on the different levels of the structural organization. Organisms, systems, organs, tissues, cells, ultrastructural level, biochemical or molecular level. Using different methods of investigation on the macroscopical, microscopical, or even ultrastructural level or genetic level. If we're talking about the clinical thing, of course, the pathology, and we have such medical specialty as a surgical pathologist, methods and approaches to study the diseases in the settings of the clinical aspect, there are three. The first one is autopsy. Autopsy means post-mortem investigation to confirm the diagnosis after the death. The second one is the opposite to the previous, is investigation during the life of the patient, which is much more valuable, really. Of course, after the death, we cannot help to those patients. But the second method is biopsy. Biopsy means investigation during the life of the patient, taking some small piece of the tissue or part of the organ or just even separate cells to investigate them, to diagnose the condition, and maybe to adjust the management of this patient or even to management the treatment, to see the prognosis, to see is it successful treatment or not. And the third one method is a special method really, of course, and we are talking about the human pathology, of course, but the third method is experiment. Using the animals, using the laboratory animals, using mice, using rats, some other animals. Of course, just to test new drugs, to see some critical pathology, to see new approaches to the treatment, surgery, so on, so on, so on. Finally, to reveal this interrelation in between the etiology, pathogenesis, and the morphological changes, then to transfer these knowledges to medicine, to the human beings. So, maybe your questions.
Sir, why autopsy is important? When the patient dies, there is no need to do autopsy.
Yeah, so about the autopsy, really autopsy has several aims. The first aim is to confirm the clinical diagnosis. Other cases, sometimes, unfortunately, patients are dying without the diagnosis because of late admission, because of very severe course of the disease, because of no previous medical help, no previous care, and on the time of the death, on the time of admission to the hospital, there is no diagnosis. And on the time of the death, there is no diagnosis. So we need to confirm that. That's the first thing. The second thing is to teach the clinicians. Of course, we are all humans, all of us doing mistakes. All of us make the mistakes. As well as doctors. Doctors make the mistakes. And the pathologists have a chance to correct their mistakes in the future, to show them, okay, this patient, that's the diagnosis, that was the treatment, but your diagnosis was wrong. Your treatment was inappropriate to that patient. Is it clear? So these are really two main purposes of autopsy. And for biopsy, I told you already, for biopsy is wider. And if we take the work of pathologists, maybe 100% is the work of pathologists, just few percent from this total time is for autopsy, and the most of time pathologists spend to analyze the biopsy. The biopsy. Okay? Okay, good luck for you. Enjoy the pathology.